Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back, everybody, to Healthy Living Tuesday. Dr. Jitka Lom continues to be here, and she is educating us about childhood diabetes. We have some wonderful questions. Maybe not wonderful, but certainly it's going to provide some helpful information. So you ready?
Yes, go
All
ahead.
right. Question number one is, Dr. Lom, is there a connection between obesity and depression or other types of psychological problems?
Wow, that's a great question. Yes, there is, for a few different reasons. First of all, obese children may have low self-esteem because they're teased by other kids and so on. That's just a tough one. They get bullied and so on. The second reason is a lot of the times these children are not as active as other kids, either because they're uncomfortable already because they're large and they get tired when they exercise because they're out of shape, so it's kind of like a vicious cycle, or they just are out of shape because they aren't moving. But when you don't exercise, you don't get those good endorphins going to your brain, so you don't get that natural high that we get from running around, especially as children. And so they may be kind of more prone to depression anyway. So those kind of two factors going, plus, some of the food that they're eating may not be the most nutritious food, and that can also change the way we feel, the way our mood is from the food we eat. So yes, definitely a huge issue. Talk to your child about it's what's inside that counts, and then work towards making the outside match the inside.
Lethargy, a very dangerous thing.
Oh,
also one of the seven deadly sins as well.
Yeah.
All right, we were saying that at the same time. All right, question number two, Dr. Lom. If my mother or father is obese, does this mean that I will also become obese?
It's more likely, especially if your mother was obese during pregnancy. We know that if obese pregnant women will tend to have larger babies, and it just goes from there. So there's a lot of metabolism, a lot of hormone things that happen to the baby when it's developing inside an obese person. And as far going forward, sometimes the parents are modeling habits for the children, eating those foods that are not that healthy, or maybe not exercising as much. So it all begins with us. We have to set a good example and do our best. Nobody is perfect. Nobody is a perfect parent, but we have to do our best if we know what's right.
All right. Hopefully kids are doing sit-ups while they watch the show right now. They're getting motivated, some push-ups too. All right. And question number three, how can I teach my child about the importance of eating healthy?
Well, again, modeling it yourself, trying to set a good example, and talking about food, making food a pleasure, not anything that you sort of are addicted to or having to, pile your plate with, just something that you use for nutrition and for sustenance. So making sure that your plate looks very healthy. You have your largest portion of your plate should be vegetables, a small portion for your protein, meaning meat, and then your carbohydrates, again, a very small portion. That would be rice or pasta. And on this island, rice is the thing. Everybody loves their rice. So please stick to 1 scoop or less per day.
Okay, well, of course, we talked about one of the seven deadly sins, sloth, gluttony, definitely one of the other ones.
Goes right there, yeah.
Okay, question number four, what would be the ideal food and snacks to pack for my kids' lunch?
That's a great question. That's a really good one, coming up for school. If you can have your child drink water and have fruits and vegetables for snack, that's ideal. You can have carrots, baby carrots with ranch dressing. You could have cut up apples. You can do interesting shapes with melon or cantaloupe that are fun for your child, cheese and crackers, some grapes. Trying to stay away from like sweet cookies, junk chips, stuff like that, and staying away from the fruit juices also. Nuts are also a great snack for kids if they'll eat it. Sometimes granola bars or so on can be quite healthy without added sugar.
It takes a little bit of work to put together a perfect lunch for your kid, but it's definitely worth it.
It does. And people tell me also that it's costly. It's costly. Patients and parents will tell me, it's really expensive to eat healthfully. But the flip side of that is you got to look long term. You're not looking at your child's lunch just this year. You're looking at how they're going to be when they're 30 and 40 years old, and whether they're going to be taking pills and shots for diabetes.
Yeah.
Just think of that.
You ever see how much the cost of a hospital stay is?
Yeah.
Balance that into your equation when you're
right.
doing your finances. Okay, last question. About how much exercise, Dr. Lom, or activity should my child be getting each day to prevent obesity?
Oh, that's a good one too. Wow. Well, national guidelines are 60 minutes a day for children under the age of 18, under 16 for sure. So that's an hour a day for every child, and they're definitely not getting that in school most of the time. And so you have to do something after school. If it's an organized activity like a dance class or a martial art or basketball or whatever you can do, swimming. And if you don't have that opportunity, just walking, running, kicking a ball, anything to get your kid to do something, especially after school, so that they can come home and be tired and have an easier evening than sort of just sitting on the couch all night.
All right. Well, we appreciate it as always, Dr. Lom. Thank you for your insight.
Thank you.
All right. And you want to stay tuned next week, because when Dr. Lom comes back for Healthy Living Tuesday, a week from now, we are going to talk about podiatry. We're going to talk about hammer toes, bunions, not funyuns. That's a completely different topic, but all things that afflictions of the feet. So make sure to stay tuned for that. But stay tuned.